So if you're like a lot of people out there, COVID-19 doesn't just refer to a virus. It might also refer to how many pounds you've gained during this last year, during this pandemic. Not good. I feel your pain. So many people are eating more, snacking more, cooking more, drinking more, but moving less, not being mindful. Our guest today is going to talk just about just that, mindful eating. So stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. Hey, Mary Beth.
Good morning, Andrea. How are you?
I'm good on this extremely windy day in March.
Yes. So welcome to March, everyone. And March is National Nutrition Month. It's Women's History Month. So we have 3 female guests today. And so let's kick off March on a good note. And today we have with us Cris Brown from Imperial Healthcare. Good morning, Cris.
Good morning.
Good morning, ladies. Good morning. Thank you for having me.
So and of course, we have to say what a great supporter Cris and Imperial Health have been of SCAN throughout the years. So, Cris,
thank you.
Thank you for that.
Thank you. Yes,
thank you. It's our pleasure. Thank you.
So Cris is here to help us kick off National Nutrition Month and talk about healthy eating for our senior community.
Not just seniors, of course, because
yes.
I mean, everything that we're talking about, you know who you are out there. Everyone is affected.
Yeah, and I think the COVID-19, doesn't pick and choose who it, jumps on, because I think we've all been a victim of it. Unfortunately, some, like you said, from the virus, and then, there are other things that we've been affected by that are, kind of those outer ripple effects of this virus. And so I just want to start by saying I'm not a registered dietitian, but I did speak with our registered dietitian who gave me a lot of great information, because she's seeing this everywhere. She's seeing this in teenagers who are home, learning and not moving and not getting to gym class and not getting outside as much as possible. She's seeing it in, in all generations that are just, kind of falling victim to exactly what you're talking about. And so some of the things that we're referring to, it's of course the illness itself, that can take a toll on you, and it can take some time to recover and to get back into your routine. Another thing is the isolation and mental health. There's been a lot of focus on that and the effects we might see. And then because of that, we're seeing this stress eating. I mean, food is just such a comfort blanket for most of us. It's something we turn to. We attach so many good memories and good feelings to good food. So in times like this, we kind of gravitate to those things. And for a lot of us, just like you mentioned, Andrea, we're eating more because we're home more. The refrigerator is right there. It's hard to pass by.
When you're in the office, you don't have that access. But here, it's 24/7 access, and that's
exactly
that's the killer here.
Yeah. And so what we're going to talk a little bit about is when we pass by the refrigerator, what are the choices that we put inside of it? Are we putting good choices in there so that when we get that little hankering to open the door and grab something, are we grabbing grapes, or are we going to the freezer and opening the door and taking out an ice cream sandwich? So we'll talk a little bit about that. But Hippocrates said it best: let food be thy medicine and medicine be thy food.
Right.
And we forget how influential what we put in our bodies every day, what that can do for us and our health. So a couple of things that we pulled from a few of the top health journals, foods and supplements, for sure, they can't cure an illness on their own, and they're not going to completely heal a damaged immune system. But things like zinc, vitamin D, iron, vitamin A's, B's, C, and E have been proven to help strengthen our immune system. So not just the supplements, we want to try to find the foods that carry those nutrients for us in case, we can't get those vitamins into our body on a regular basis. Like you said, being isolated just has not helped us. And one other thing, especially I think maybe with the older community, getting to the grocery store was not easy during this pandemic. And so putting the good things in your house wasn't as easy as it used to be. Running out to ShopRite, going to Stop and Shop, maybe getting a pickup if you weren't someone that was going in the store. At
Right.
some points, you couldn't even get a Peapod delivery,
Right.
you know?
Right.
So those really raised some challenges, I think, as well. And because so much switched to technology and being able to get, your deliveries on Instacart, again, for a population that isn't as familiar with technology, that I think became a barrier as well. So just a couple of things that I think that, kind of like the David Letterman top 10 list. So
Yeah.
here are the top 10 foods that you should really try to keep in your refrigerator, in your pantry, that will help reduce inflammation, boost your immune system, and just keep you feeling better. Number one, oranges, vitamin C. We all know that. And vitamin C is something that is so important to our bodies. And oranges are delicious. You can do it with juice, make a smoothie, but oranges are something you want to see. Grapefruit. Grapefruit is also vitamin C, but it's also high in antioxidants. That's another good one. Bell peppers, especially the red bell peppers, have both vitamin C and vitamin A. And then we moved into unsweetened yogurt, which has that probiotic. And there are a few doctors on News Channel 12. There's a doctor, and I'm sorry, I'm forgetting his name, but he's all about gut health. If your gut is healthy, the rest of the body responds in kind. So that's something, unsweetened yogurt. Garlic has allicin in it, which is an immune supporting compound. And garlic, just make sure, I guess while we're social distancing, it's safer to increase your garlic.
Absolutely.
Green peas and lentils carry a lot of zinc. Mushrooms have both zinc and vitamin B. Number 8 is berries. Berries have a lot of really good things, a lot of antioxidants, and you mix it up. If you like berries, the more color in your berries, the better. Turmeric is an anti-inflammatory, and you can find that now. They even make coffee sweeteners with turmeric in it. So you can add it into your diet in different ways without having to kind of spoon it out of the spice cabinet. There's a lot of things that have turmeric added now into the food. And the last one is a great one, and it's sweet potatoes, which has both the beta carotene, which converts to vitamin A, and it also adds fiber to help with the gut. So those are some things we can put into our pantry and refrigerator so that when we get that little craving and we pass by, maybe we're just grabbing something that will do a little more for our body.
So what we'll do, Cris, and everyone who's listening, you don't have to, if you didn't get all of that top 10, we will make sure we put all of that in the comments so that you'll have that at your fingertips.
Yeah, that's great.
It's really about, preparation, knowing what the right food is, having it in the house so that when the moment strikes you, you have it there to reach for.
Yeah, exactly. And something else, just taking it a little further, if you'd like, if you're watching this, obviously you're tech savvy. So something you may want to think about is if you do have a smartphone, there are so many great apps that are free. Some, it starts with a free trial and you might have to pay. So you definitely want to look into them. But Medical ID will help track all of your health information. And then also first responders can use that should there be an emergency. There's MyFitnessPal will track your calories that you burn, and you can also add in what foods you've eaten. There's Carb Manager, which is really interesting. You can put things in and it will tell you the amount of carbs, that you've accumulated throughout the day. Diabetes Connect is really good for those who have diabetes. My Sugar also will watch your sugar intake throughout the day. And then there was another one I just recently found called Silver Sneakers. And Silver Sneakers actually creates workouts that are safe for, some of the patients people who may have some issues that they need to keep an eye on, whether it's they have a program specific for heart patients, people who may have pulmonary issues. So that's another great app to check out.
Well, thank you for that. Well, I wrote those down too. We'll put that in the comments too, because
Sure.
anyone, we said this earlier, it's about being mindful, really thinking about what you're doing. And you have that moment of choice when you go to the refrigerator and you go to grab A or B. Got to think about the choices and the consequences of your action. Although, I guess when you're stress eating, you don't, but you think about it later.
Right.
That's the problem. All right, those are all excellent ideas. Cris, you want to say something about hydration, because that is a big issue too, as part of
Yeah,
nutrition.
sure. So, unfortunately, we did see some COVID here in our facility. And the one thing that was just so critical, and this is critical just on, if you're a healthy person, you need to keep up your hydration. It's so hard in the winter, though. We just don't feel like drinking because we're not, taking the water out of our bodies like we do when it's warm. There's another app, actually, it's called Noom, and Noom actually goes through more of the psychological explanation as to why we gain weight, lose weight. One of the things that they talk about on there is that, we're all taught you have to drink X amount of water, but it really is very different for every person. But they do recommend, there is the, I think it's 8 ounce glasses of water a day is the, recommended, but just make sure that, you are taking in as much fluid that's comfortable for you, because a lot of people have factors, whether it's renal issues, just different health issues that could determine what is the right amount. So what they do recommend is that you do actually talk to your doctor to find out what specifically is the right amount of hydration for your particular situation.
Yeah.
All right. Yeah, because everyone is different. You know what else, Cris? These days when people are shopping, do you still feel like we have to wash our groceries and our produce the way we used to when we were
So
coming home from the store?
yeah, I think the CDC has said that we don't need to do that now. So I would say that, again, everyone is taking the COVID measures to their level of comfort. And I think that we need to just respect each other's decision as to what that means for them and their family. We were definitely doing that in the beginning in my household. I would say maybe we've tapered off a little bit. But I would just say always refer back to the CDC, to the New Jersey Department of Health website. There are so many good resources, and those are the people we should really be listening to. So I try to always refer back to the best source to when anyone asks me a question that I'm not 100% sure of. I would always refer you back to those people who are gathering the information and getting it out to us as quickly as possible.
And because it is March and it is National Nutrition Month, this is a perfect time for everyone out there to just really, if you weren't aware before, to really think about what you're eating, why you're eating it, and being mindful. Maybe you do need help managing your stress. That's a whole other conversation. But stress eating, they don't call it stress eating for nothing, do they? It's like the collateral damage of COVID is all of the stress eating and drinking. And you don't want the COVID-19 to turn into the COVID-30.
Yeah, no, definitely not. We actually saw a little bit of this prior to COVID. We had a situation where we actually had a patient come in from the hospital, and he was underweight. He came here. The food here is actually really good. So he gained about 12 pounds while he was with us for about 3 weeks of rehab.
Wow.
And we sent him home. Unbeknownst to us, his wife wound up in the hospital. And so he was home. We set up home care, equipment, medication, everything you would for a patient who's going home to be successful. What we didn't realize was that his wife, who was now in the hospital, was the one who was cooking and preparing meals and doing the shopping. We got a phone call from a friend of his that his wife was in the hospital and that he was not doing as well as he had been when he first went home. We brought him back in. Maybe he was home about 2.5 weeks. He was already down another 5 to 6 pounds. And so we realized, as a team, how could we avoid him having to come back in to rehab? We did the medicine. We sent home the care. We set him up with his doctor. All the equipment was there. He needed food. And so, we forget how important that is in the big picture. And so we created a little something called our Healthy Pantry program. And what this does is our registered dietitian, Roseanne, meets with our patient before they leave for home. And we teamed up with ShopRite, and they actually get a delivery within about 48 to 72 hours to their home of foods that are lined up with their clinical needs,
Very nice.
that we at least know for those first 2 weeks they
Right.
have food in the home until the family can get in there and, you know, get their routine back on track. So that's something that we looked at because food is so important.
To your health. Yeah.
And
That's
it has
Yeah.
been so challenging during COVID for a lot of people to actually acquire it. So I think what you're
Yes.
doing is a good thing. You know, remember now we're going like almost a year ago when on Instacart, you couldn't even get an appointment. It was just like an impossible task to have anything delivered. It's really,
Yep.
like very dark days for a lot of people, just not having any kind of access and being so fearful of going out to the grocery stores. Yeah. I mean,
Yeah. And I want to give a little, shout out to anyone. I saw a lot of Facebook support with just people. Do you need groceries? Are you home alone? Put a sign in your window if you need food, if you need help. I just thought there were so many great ways in which the community pulled together to
Yeah.
try to help those who couldn't help themselves. And we're seeing that now with the vaccines. There's a whole Facebook page
Yes.
dedicated to people who are going out of their way. So I just want to say, in those dark days, there is still some light. People have really come through in ways that maybe we even surprised ourselves through this, and it was nice to see.
It is nice to see. So for all of those out there, thank you. Thank you for rising to the occasion. But more important, remember, you are what you eat. So National Nutrition Month, pay attention. That's the important
Definitely.
thing. Yeah. All right. Well, Cris, thank you for sharing all of that good stuff. Reminder, everyone, we'll put all the information in the comments, the top 10 food list. I like that. And all the information about how you might want to reach out to Cris, right? Any final
Thank you.
thoughts, Cris?
Just please continue to take care of yourselves. I know we're all getting our vaccines, and, just continue for the safety of everyone. Hopefully we can have some fun this summer together, and it'll be really nice to get some hugs.
Wouldn't that be nice? Wouldn't that be nice? Yeah. Okay. Well, remember, everyone, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone.
Everyone. Bye, Cris.
Bye.
Thank you.